you do not live in a community that does not offer some type of mammogram services. Now again, it might be once a month by a bus, it might be the hospital, you may have to drive a little bit, but there are resources in the state of Kentucky through the Cancer Care Network. We can help you get a mammogram. Unless there is some history of breast cancer in the family that would change that year, but in general, starting at 40 years old, and the American College of Obstetricians and Gynecologists recommends annual breast cancer screenings with mammogram every year. Also, making sure you know your family history. That is very important. And just making sure that you understand what your family member was diagnosed with can be very helpful. Not all cancers are genetic or hereditary, but it is helpful to know kind of with that age idea. Getting a regular breast exam, that's part of the clinical breast exam that's included in annual exams. But for ladies that are choosing not to participate in that, even just a monthly or every other month self-breast exam, being familiar with their own breast tissue. Healthy lifestyle, we cannot encourage that enough. Breast cancer is, as horrible as it sounds, just like every other cancer, so we really recommend healthy lifestyle, fruits and vegetables, fiber, making sure you don't smoke, limit the alcohol intake, and staying active. The last thing is really just anytime there's concern, just call. That's really just the biggest thing with breast cancer, breast issues, is just making sure that ladies stay engaged. Not just early detection. I think a lot of women are afraid of false positives or false negatives. And so early detection is obviously the key with any type of cancers. But the earlier that we know, the less invasive the surgery. There's a big difference with recovery from a lumpectomy versus a mastectomy, which is a partial removing the cancer tissue versus having to remove the entire breast. Recovery is different, so even something as simple as that should encourage women to keep up with their mammograms and their other screenings that are recommended. The earlier it's diagnosed, the better your 5-year, 10-year, and 20-year survival rate is, and with quality of life. Really, the idea is just to encourage people to attend their scheduled screenings. If you have somebody that you care about that you feel like is not getting their appropriate screenings, offer to drive them. Say, hey, I'll take you to lunch if you go get your mammogram.